Good evening, and welcome to our discussion tonight. I'm Dr. Mensah, and welcome to Mensah Medical. Our discussion is going to focus on, really tonight, one of the most difficult topics I think I've encountered. We've dealt with everything from schizophrenia to bipolar disorder to autism to a variety of torturous and very difficult discussions. However, this one proves to be one of the most challenging that we've ever encountered. And that one is understanding the teenage mind.
Yeah.
This is a myriad of complex issues, ranging anywhere from what we typically understand to be hormonal changes, to social circumstances, to what we often just attribute to being a teenager, in quotes. However, what we typically don't realize is that there are a myriad of biochemical abnormalities and changes that are occurring as well. So tonight, we're going to try to focus a little bit here on the biochemical side, biochemical nature of moving from pre-adolescence to young adulthood. So let's kind of get started here. Before we sort of delve into the major mechanisms, we want to talk about the human brain in general. The brain is actually a wonderful, wonderful predecessor of the computer. Okay. It was designed in many ways to carry out more functions than we can possibly comprehend at this juncture. However, the brain doesn't just work on automatic. It doesn't just have everything it needs in order to function at its disposal. The brain is a chemical factory. And like any other factory, it doesn't just operate. It requires fuel, it requires direction, it requires motivation, it requires impulses, directions, orders, a plethora of circumstances, really, in order for the brain to function well. Now that's just at the, shall we say, steady state level. We're not talking about what this all requires to get it moving. So let's talk a little bit about that. Any factory requires what we consider to be substrates. That is a form of a product or molecule that gets modified or turned into something else, and then gets modified again, and then gets modified again, and finally you end up with the final product that you're looking for. In this case, we're not going to talk about tires, and we're not going to talk about cars. We're going to talk about neurotransmitters, NTs for short. We're going to talk about hormones. We're going to talk about enzymes and various other chemical markers. All of these have to be produced. Now, some of them are already prepackaged in forms of pre-hormones or pre-chemicals or pre-enzymes. They then become modified by different elements in the brain, and they get turned into active forms. So I want you to recall this, that we're not talking about what is simply there and waiting to be used. These are elements that have to be first produced, then modified, and after that, they have to be appropriately disposed or inactivated. That is the key process I want you to remember if you don't remember anything else. The brain is a chemical factory, and we literally produce many of the elements we need to function. Okay? That's very, very key. All right. Now, what does that have to do with teenagers, right? Well, we'll get there. How do we get or acquire these substrates? Most of the time, diet is the key. I know you guys are thinking, oh, okay, it's going to be another discussion about diet. We already know this. Kids eat terribly, and so forth and so forth. Well, that's only part of the puzzle. Because, yes, indeed, we do need to eat the proper foodstuffs in order to break down our proteins into amino acids. in order to break down our fats into their composed parts. All those things do come into play in order to have the appropriate building blocks that our body needs or requires in order to make all these lovely neurotransmitters, hormones, enzymes, etc. Now, that's all I'm going to say right now with regard to diet. But I want you to remember this process. Now we're going to shift into a bit of pathology. So we're going to jump into another area at this point. Let's talk about neurotransmitters. And by neurotransmitters, we're referencing chemicals that most people have heard of. Chemicals like serotonin, chemicals like norepinephrine, chemicals like gamma amino butyric acid, which we often call just GABA for short. Also, we want to look at, let's see, what else here? Serotonin, norepinephrine, GABA, adrenaline, and a variety of other neurotransmitters. Now then, what's key is that we in medicine have approached neurotransmitters as though they're pretty much the end-all and the be-all. Everything that we do with regard to health involves somehow or another trying to make sure we've got as much of these neurotransmitters out there as possible. We presume that depression is based upon an imbalance of neurotransmitter levels, and the way we deal with that is to provide drugs that stop our neurotransmitters from being destroyed. That way we build up more of the serotonin and more of the norepinephrine, and that's supposed to help us become wonderful and happy people, as opposed to what we typically see are sad and oftentimes depressed people. Well, we've noticed that when we use drugs such as the SSRIs, drugs like Paxil, for example, we oftentimes get a good result or a good response. But then in some individuals, it doesn't seem to work, or it doesn't seem to work very well, or it doesn't seem to work for too long. And then what happens? We have to now increase the dosage of that medication. And while that didn't work too well, so we increase the dosage more. Now here's the deal though. When we do that, we often increase side effects. And now we get individuals who are not too happy with the end result of these higher concentrations of their medications. And then what do? Oftentimes they stop without telling the doctor. And quite often that creates a cataclysmic end result with regard to side effects and withdrawal symptoms and a variety of other issues or challenges. Other drugs that we've used include newer categories called the SNURPS, SNURPS. These are drugs that affect both serotonin and norepinephrine reuptake inhibition. Drugs like Cymbalta, for example. Now, don't get me wrong. Once again, for a variety of people, these drugs work pretty well, and they maintain a decent lifestyle based upon the utility of these particular drugs. These are just examples, and by the way, I have no stock in any of these drugs being mentioned here, so I'm putting that out there for you, okay? These are just regular examples of what's happening out there. Now, the difficulty is, once again, here, we're talking about side effects, and we're talking about these kind of profiles. Now, in the world of orthomolecular medicine, we kind of want to take a different look. What we're trying to do is we're not trying to say, well, how do we stop these neurotransmitters, these chemicals, these hormones, these enzymes from being destroyed and therefore increasing the amounts of these elements? Our question becomes, how do we help the body regulate and produce by itself the proper levels to begin with? That's where we revisit the world that pharmacology is based on, which is the world of biochemistry. Let's take a quick look here. Let me erase this a little bit. One of the interesting aspects or questions regarding these neurotransmitters is, what does it really take to make a neurotransmitter? And this is the same question we ask many doctors who kind of question, well, Dr. Mensah, how on earth are you saying that you're going to bring up these levels without drugs? Everyone knows you need drugs in order to affect neurotransmitters. And you say, well, here's one question for you. How do you make a neurotransmitter to begin with? And then you get sort of these pauses, and they say, well, you need enzymes, and you need a variety of other elements. And I said, like maybe amino acids. And they say, oh, yeah, those are usually basic starting points, certain amino acids, if you will. And then you require some type of what we call a cofactor. It's an element that stimulates the enzymes to work most maximally and most effectively. Many of these cofactors are what we call micronutrients. These micronutrients can be anything from metals like zinc to vitamins like vitamin B6 and vitamin C. And once again, many people are thinking, okay, it's another lecture on vitamin C and zinc and B6, and yes, we know they're all important and blah, 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 tell me something I don't know. Well, here's the deal. Now that we've mentioned it, we're going to erase it. Now let's ask the question. What are some of the key regulators in the production of serotonin? Well, it just turns out that in order to effectively produce serotonin, you need both zinc and vitamin B6 as part of the equation. And then what we hear typically from our colleagues is, well, yes, of course that's true, but you only need very small amounts of those things, and they do the trick. They get everything moving in the right direction. Well, what if you don't have enough? Okay, and that's just with regard to individuals who are what we call functioning quite happily and normally in life. What about the people, on the other hand, who have cognitive difficulties? That's actually where we come in our specialty. We look at individuals who have the depressions, who have the anxieties, who have the bipolar disorders. And we ask the question, what kind of difficulties or imbalances are present in these individuals? Well, in order to look at serotonin, the real question is, what if we find out that there's an actual zinc deficiency present? Well, if there's a zinc deficiency, and we know that zinc is a key regulator in the production of serotonin, then it seems quite logical that you're going to have an imbalance in serotonin activity or in serotonin production. Yes, ma'am.
Are there tests to measure inadequate levels of certain vitamins?
You know, we've never met except for tonight, and I can tell you, yes, indeed, there are. Absolutely. And we'll get to some of those tests
Okay,
as we
I'll shut
discuss
up.
later. No. These questions are always welcome. Yes, indeed. We can test directly for zinc levels, to answer your question, and we can test indirectly for vitamin B6 levels. Now, I know there are tests out there that people use for vitamin B6, but the fact is they're not as accurate as it's thought to be. Okay, so we use one indirect measure that's far better. But we also found out that zinc is also a key regulator in the production of norepinephrine and in the production of, what I didn't put up there, dopamine.
Mm-hmm.
Okay? So if you're zinc deficient, and you happen to have some of these cognitive challenges that we mentioned before, not only is your serotonin going to be out of balance, but so is your norepinephrine and your dopamine levels. Okay? Anyone who's done research in any of these disorders of the mind will often reference that there are questionable dopamine activity or inactivity difficulties, as well as serotonin. So now the question becomes, how can we help deal with these situations? Okay. Now, we've referenced the idea of imbalances in neurotransmitters. I want to talk a little bit more about now the testing and how some of these elements become extremely important in the regulation and the production of these neurotransmitters, and therefore produce signs and symptoms that we consider to be somehow inappropriate behaviors or inappropriate cognitive processing. Okay? We talk about zinc deficiency. We talk about vitamin B6 deficiency. But, oh wait, Dr. Mensah, is it possible that you can have too much of a given element and cause a problem there as well? Well, I'm glad you guys asked that question. Absolutely. Copper, Cu with a +2 charge, stands for copper here. Copper in excess can also cause difficulties. Okay? One of the elements that we look at also that in terms of deficiency, everybody's kind of heard of it. Vitamin D has been in the press quite a bit now, because we're finding newer and newer uses and importances for vitamin D levels. Okay? I want to kind of pause here for a minute and talk about these first two. We talked about their effect on neurotransmitters. But is there a third party, for example, that can actually affect zinc and vitamin B6? And the answer is yes. There's a molecule that's part of our regular hemoglobin synthesis, our development of the carrier protein that carries oxygen in our systems. That protein is called a pyrrole, Pyrrole, pyrrole molecule. I often sort of draw sort of a house figure with a circle, which stands for sort of a benzene ring in chemistry. Add a little NH group here and a double bond there to sort of illustrate the pyrrole molecule. It carries iron. Okay? Now, quite typically, when the iron leaves the pyrrole molecule, which is what it's supposed to do, the pyrrole molecule undergoes what we call a conformational change. Now, this is just going to be diagrammatic. It's not meant to be 100% accurate. But there's a change in the structure of this molecule that makes it extremely adhesive, extremely sticky. It's kind of like it broke up with a significant other and it's looking for that rebound relationship. But this time, when it finds that new lover, that new friend, it's not going to let it go. But guess what two elements it gravitates towards in an extreme fashion?
Zinc and vitamin B6.
Zinc and vitamin B6, absolutely. It holds on to these elements so strongly that it will leave the body through the urine, still holding on to that zinc and vitamin B6. Well, Dr. Mensah, so what? If you lose a little bit of zinc, a little bit of B6, what does that really sort of mean here? Well, remember that zinc and vitamin B6 were two of our key elements that help regulate neurotransmitters. So if you have a few of these molecules missing, perhaps not such a big deal. But what about if you have a large number of these pyrrole molecules present? Now you're losing a tremendous amount of zinc and vitamin B6 from the system, and that leads to a tremendous amount of neurotransmitter dysregulation. So, for example, when this happens, what might be some of the signs and symptoms of pyrrole disorder? Well, another good question. Anxiety, anger. Sound like a teenager for one moment. Happiness with a quick transition to sadness or rage. Does that sound familiar to anybody who's ever been with a 13-year-old or the 16-year-old category? Okay. These individuals often also have sensitivities to light, odor, sound, and texture. I like to say they're kind of lost in that sense. Okay? So we call these folks pyrolurics, so to speak. Luria coming from the urine here, and pyrrole from the molecule. Okay? Now, it's not just anxiety or anger or rage. It's how it happens. It happens very rapidly. Many of these individuals have been inappropriately misdiagnosed as being rapid cycling bipolar individuals, okay? Because they move so quickly back and forth through different stages. Now, what's really key here is the understanding that in psychiatry, the way we diagnose individuals is that you run every test you know of, so to speak. And if you come up with no answers, then the mental processing difficulties has to be psychiatric in nature. Okay? So That's fine and dandy, but what if you didn't know about pyrrole disorder? And you had a young person come in who was constantly up and down in moods, even an older person for that matter. And you say, well, they have to be bipolar. And well, the rapid cycling, but you know what? You never ordered a pyrrole test because you didn't know about it. And now you label them as having bipolar disorder. And then later on, we find out, guess what? They're pyrroluric. What's really interesting? Yes, there's a test. Absolutely. And that test is, guess what? It's called a pyrrole test.
Do they perform them in hospitals? Is it like standardized procedures? So it should be...
No, it's not. This is very new for a majority of American physicians and for a majority of healthcare workers in this country and in many parts of the world, as a matter of fact.
Does Linden Oaks offer those kind of testing?
No, it does not. Not yet, anyway. We're hopeful that eventually in time things will evolve to the point where they can get these kinds of tests. But first, you've got to be aware of it. My old residency attending in surgery used to say to me, a lovely Jewish fellow, Dr. Zarek, he'd say, you know what, Al, the eyes can only see what the mind knows. If the mind does not know it, the eyes can't see it. So if you're not aware of these phenomena, you're not going to order tests for them. And you're not going to be able to make the appropriate diagnoses. Okay? So, the idea here is that anxiety, anger, depression, these are symptoms that can be seen with at least one biochemical disorder. Well,
Is there treatment for it?
yes, there is. Young lady, you're getting ahead of me. We're going to get there. But that's all right. I'm glad you asked the question. That's very important. The fact is, there is treatment for this. As a matter of fact, this particular imbalance can resolve in as little as 3 weeks to 3 months.
Wow.
How about that for your Christmas stocking? I know we're past Christmas at this point. We'll go for Valentine's Day. Okay. Now, similarly, on the other hand, because we're losing both zinc and vitamin B6, oftentimes we see with a zinc deficiency symptoms of anxiety, depression, fatigue. Has anyone ever Googled zinc?
Mm-hmm.
When you Google zinc, how much do you get on the page in the internet?
Actually, quite a bit. You know, there's a lot out there. The question I have is, because everybody is different, I assume the appropriate level of zinc quantity in your physiological makeup must be different.
Not necessarily.
Okay.
Now, what's interesting with regard to the designer of the human form is that there are very standardized protocols involved. Okay, now, yes, there is some variability from person to person. But for the most part, you still need X amount to get the job done. The point that I was referencing here is that when you Google zinc on the internet, you get about a page and a half of stuff that zinc does. It's important in growth. It's important in health and immunity. It's important in a lot of dietary gut issues. It's important all over the place, hair and nails and so forth and so forth. Okay, that's just to say the least bit. Individuals who have good solid zinc levels, for example, tend not to get sick as often. And you know what? It's not just us in this field that are talking about it. When we go to the pharmacy, what do we see? Products like Zicam. What does Zicam do? Zicam is an element that you spray in your mouth when you think you're getting a cold. You know what Zicam has in it? Zinc. When you cut your hand and they put a little tiny gel, kind of an antibiotic on your skin, one of the most common forms is called bacitracin, but there's a second word in bacitracin, zinc. Bacitracin zinc oxide. Zinc is a very powerful element, one of the biggest multitaskers in our system. Okay. So, do you think just a little bit of zinc is going to do all that? No. You actually require much more zinc than we previously thought. That's been a very big misconception that was taught to all of us physicians from beginning to end, that when we have micronutrients, we only need micro amounts. And that's not entirely true. We need much higher concentrations that we're beginning to see in order to affect the kind of changes and to do what we need to do.
So higher than the RDA, huh?
Well, if you're going to treat cognitive imbalances. We say higher than the RDA, but you can't do this on your own. This requires first testing, okay? And then you need a skilled professional to evaluate that, because it's not just a simple chemical level. It's also looking at symptoms, looking at heights and weights, adults versus children, and a variety of other variables. Because these elements don't act by themselves. There are relationships to be had, okay? Let's talk a little bit about copper. Copper is a very, very interesting element. And that is because it too is important in the production or in the regulation of a variety of enzymes and a variety of systems. But copper in excess can be extremely troubling. Okay? High levels of copper are associated also with anxiety, depression, rage. Do these sound familiar at all? Does that sound familiar? Okay. Fatigue. And I want to explain a little bit about the mechanism of the copper. Back in 1942, this is how long this goes back, there was a study done, and they put copper, I believe it was 5 milligrams of copper, in a petri dish with a nerve cell. When that copper hit that nerve cell, that cell lit up with activity. It was then understood that copper can have the same stimulatory effect as ephedrine. High levels of copper to the brain, to nerve tissue, is like being on speed. Okay? So now, let's understand our brain is both electrical and chemical, correct? So now we know copper is a great conductor of electricity. I think we know that. Copper wiring, okay, it also conducts heat very well. Copper pipes, copper pots, cookware, okay? So now we've got this element copper, which we know is very stimulatory. Well, we've seen that in the human brain, which is made up of billions of nerve cells, if you have too much copper on board, it's going to hyperstimulate those nerve cells, okay? And that's where we get the mechanism of the anxiety. And we know over time, anxiety and depression almost have sort of a reciprocal relationship. One tends to lead to the other. Now, if you're stimulating different centers of the brain to excess, you can end up with rage. If you're stimulating your muscles to excess, you can end up with fatigue. Copper can be a very, very difficult element because there isn't a system in the human body that copper does not affect. How do you get fatigue, you may ask? Well, I'm glad you asked that question. There's a pathway in biochemistry called glycolysis. There's a pathway full of enzymes, and each one of these little slashes represents an enzyme. And this pathway connects to a larger pathway we call the TCA cycle, which then connects to another pathway we call the electron transport pathway. And that produces basically energy, what we call ATP. Well, copper affects 3 different enzymes in the glycolytic pathway, and it kind of shuts it down. Not entirely, but partially. But enough so that we end up in the big picture, dozens and dozens and dozens of reactions later, having very little energy production. So we end up with fatigue. Okay? Copper is a big problem. Now,
How do you end up with excess copper?
that's a good question, and I'll get to that in a few minutes. Okay. Because what I want to do is to talk about a subject that unfortunately has been very difficult for many people. But in order to do that, we're going to have to talk about females. Roughly, 49+% of the population? Or 51 to 1, 52% of the population? Absolutely. Copper serves a very, very important role in both males and females especially. And when we talk about that, we also have to talk about estrogen. Because estrogen increases copper. And why does that happen? Well, a variety of reasons, but let's talk about the process of gestation and getting ready to give birth. Okay. First, you've got to kind of get the ball of wax rolling and get the sperm and the egg together and move development along. In order for a baby to grow, it requires blood vessels. Okay? Well, in order to actually make blood vessels, you need copper. So copper's not exactly a bad guy all the time. So when you're pregnant and your estrogen levels rise, use a different color marker here, so too will your copper levels. Okay? And that's good, because the fetus can grow without blood vessels. Now then, after you give birth, estrogen levels go down. And in theory, copper levels should also go down. Now, there's a subset of females, however, where the copper levels do not go down. They stay at that pre-birth level. Well, not a big deal, perhaps, maybe, right? Unless you're a copper-sensitive female. Second pregnancy comes along, and estrogen levels rise again. Copper levels will rise, but not from ground zero. They take off from where they began before. Now, I want you to keep in mind what copper does to the brain. Okay? I want you to now extrapolate. Let's build this out to the third, the fourth, or the fifth pregnancy with a female that can't get rid of copper. Now we become quite problematic. The landmark research that was done by Dr. William Walsh of the Walsh Research Institute, our mentor, our friend, showed that 85% of women who had postpartum depression, they had it because of high copper levels. Now, that wasn't even talking about the women with postpartum psychosis, although they were included in the study. You've heard of these women so often. A woman with 4 or 5 children, kills her husband, maybe not in that order, turns and kills herself. These are the women we're talking about. The ones who have become so copper toxic that their brains have become psychotic and disaster happens thereafter. Okay? We didn't know this before. We have this understanding now. Okay? Copper can be extremely dangerous inside the human condition in excess. Okay?
Does the second, third, and fourth fetus and or baby then end up with higher levels of copper as well?
We know that this is a very possibly genetic or epigenetic phenomenon, where there's the tendency to not be able to break down copper, that can often be passed on to the children. Not just girls, boys also. Which brings me to another point. What about the guys? Let's be fair to them. Yes, sir.
Why do they depend on copper?
Why?
Because it's poison.
It's a great conductor of electricity, and they didn't know about the poisoning part beforehand. And it's still not quite so out there in terms of general knowledge. I was watching, quick deviation here, I was watching one of those home and garden channels. I love HGTV. Yeah. I don't own any stock in that either, just to let you know. But knowing what we know, and knowing how we feel about copper, there was an artist in Arizona who built this humongous structure. Everything was made out of this same substance. And guess what it was? Copper. And guess how Dr. Mensah reacted? With palpitations.
Yeah.
He said, oh my goodness, no. Children, everyone affected by copper. Okay. Those are the girls. Now then, boys who are unable to process copper very well oftentimes have oppositional defiant disorder type diagnoses.
And what is that?
Oppositional defiant disorder?
I asked that, yeah.
That's a disorder where kids seem to just say no. Okay. But they do it to very specific individuals. Oftentimes it's really people of authority. Okay. Their friends are usually okay with, outsiders perhaps okay with, but family to authority figures they say no. What's the big deal? That sounds like, any other kid, right? Well, these kids, unfortunately, are the ones who are turning over garbage cans. They're causing trouble in the community. They're often moving on to a conduct disorder, and they're often in jail by the time they're 16. And it's because of not all the kids, but in many a child, it's because of their inability to process copper. Okay? So we've talked a little bit about copper, about zinc, about a few trace elements and some metals here, because I wanted to illustrate that there's a great deal of importance to micronutrients. There's something else I want to discuss, and that one involves the concept of methylation. This is becoming one of the...
Sorry. How genes get expressed?
Ah, you're getting there. You're one step ahead. We'll talk about that.
I'm sorry.
That's quite all right. This is, we like questions, so feel free. This, in chemistry, simple methyl group. And what I found out after years of being tortured in chemistry class is that this is far more important than I ever knew or understood. This methyl group is actually both an activator and an inhibitor, or suppressor, of different enzymes, hormones, neurotransmitters, and even, yes, genetic activity. That was the real big one. Because in the field of what we call epigenetics, early research with cancer showed that methyl actually suppresses cancer genes. Okay? And while they used that as a foundation, they were using certain therapies that they thought would help improve methyl with cancer, and patients didn't do too terribly well. Well, there was a reason for that. They actually chose the wrong elements or substances, and so patients died, unfortunately. But we also came to understand that what we had been thinking all along about methyl was really true. It's hugely significant. Let's speak, for example, about, once again, that molecule we were talking about, serotonin, that neurotransmitter. Now, you know, lots of people, lots of places do testing for serotonin and different neurotransmitters and say, oh, your levels are just fine, okay? Well, what if you've got serotonin, but it's not activated? What does that test really show you? It doesn't tell you anything about function of serotonin. It's only presumed because there's some type of mental or cognitive challenge. But if you don't know what your methylation status is, there's no real way to say, you know what, this person may not have enough methyl to activate those enzymes, hormones, and neurotransmitters, or may not have enough methyl to suppress not only the cancer genes, but some of the other biochemistries that require modulation. You don't always want to be full of ephedrine and activated with ephedrine. Sometimes you need the calming neurotransmitters to take over. That's how we maintain balance in our systems. Now, so we've talked about methylation here, and you kind of alluded to something interesting. You can have too little methyl, and we call that under-methylation. And you can have too much methyl, which we call over-methylation. Okay. What's very interesting is that methylation in many ways kind of shapes who we are. We found that there are some very statistically consistent characteristics of both categories, the under and the over-methylated individuals. For example, under-methylators tend to be very perfectionistic. They tend to be constantly on the on button. Nothing ever gets really, really, really good enough for them. They're always seeking to move to the next higher level. Consequently, they tend to be high academic achievers. So you know what that means, right? They typically go on to become all the Ds in the world, the PhDs, the MDs, the JDs. But, now to be outdone, they often are great secretaries. Salesmen oftentimes are extremely undermethylated individuals. And that's a great thing. But what happens if you are just too far undermethylated? That perfectionism can lead to areas like anorexia. What is a female or even a male who's got anorexia really thinking? I'm never perfect enough. My body shape, my body type, my facial structure, there's always something to be improved upon. And they keep striving for that perfection that they never reach. sometimes to the point of death. We've also noticed that many other conditions tend to involve methylation. Conditions like autism. I'm running out of space here. The vast majority of autistic children are undermethylated. Okay? Individuals with ADHD, OCD, okay. A great number of pathological disorders are being seen with low methyl and low methylation. What about the overly methylated individual? They're also very interesting. These aren't necessarily the perfectionists. These are more of the laid-back individuals. These are what I call your easygoing, smooth jazz listening kind of folks, the laid-back people. These are your poets, your philosophers, your artists, oftentimes your musicians. Okay. Just throwing out a few for you. Not everyone falls into these categories specifically, but the difficulty here is that these folks are also your thrill seekers. And why is that? They have so much methyl and they're so suppressed that they require a higher level of stimulation in order to feel alive. So they're going to go out and do things like perhaps get into a spacesuit, fly to the edge of space, and jump. And they're going to fall and fall and fall and hopefully survive. Or they're going to get on a motorcycle, rev that thing up on a ramp, jump through 3 rings of fire, cross over 12 trucks, and hopefully make the landing on a ramp. And a lot of times they don't. But what do they say after they've broken 30 or 40 bones, and everyone rushes to them and they're concerned, and they say, Johnny, what happened? Are you okay? They say, oh, dude, listen, next time I do this, after I get out of the hospital, I'm going to rev that engine up, absolutely, 5,000 more revs, and then I'm going to take off. I'm going to hit that landing next time. And you wonder, gosh, I had enough stimulation just watching that, let alone being that. So a lot of these folks are risk takers.
So the guys in the Jackass movies?
I have to say I haven't actually seen those, but I kind of get the idea. Yes.
Are these the type of people that don't require having any sleep also?
Well, that's an interesting one, because we're moving into oftentimes a realm of pathology, and they can be undermethylators too, by the way, the ones who don't get any sleep. We'll get into that, because that often tends to be one of the predisposing variables that moves us into schizophrenia or psychotic breaks. So I want to kind of hold on that. But the idea of methylation, which basically we've just kind of really skimmed and done some just general work here, is extremely important. And why is that? Well, we'll get to that when we talk about treatment. Okay? Now that you've all mastered the chemistry, the biochemistry of pathology.
And you said you can test for under and over?
Yes, ma'am. We can test all those. Everyone asks about tests. Let's talk about the testing for a minute. We'll get to that.
No.
Sorry?
No, I was just saying it's like in the realm of like medical systems.
It's not well communicated, obviously, to us lay people.
Well, it's not very well communicated to science people. We've got a number of doctors, of practitioners, who are now only learning about these disorders and methylation, for example, about the significance of zinc and zinc testing and so forth, and the connections therein. So it's not just you, it's not the medical schools yet, it's a significant number across the country, practitioners around the world, who are only learning these things. And they're all trying to figure it out. So one of the reasons we're doing this is to try to help share it and explain it. Okay. Let's talk about testing. Plain and simple, we can do a zinc test. That's not difficult. Plasma zinc is the best way to look for that. Now, when we talk about evaluations, though, I'm going to skip over to methylation. There is now a very good test for methylation, but it hasn't yet been quite worked out in terms of all the bugs, because there's some mechanical issues about time and distance and how quickly these things sort of happen. So we're still using what we call a histamine test. Histamine has an inverse relationship with methyl. So it's opposite. It's like a teeter-totter. Okay? If you are high in histamine, you tend to be low in methyl. And why is that? Because histamine does relate to methyl directly, which is it suppresses it. So the more histamine you have on board, the lower your methyl is going to be. And the opposite is also true. If you are a low histamine person, you tend to be a high or over methylated person. Okay? Now, that's the general idea behind the test. And we use a whole blood histamine test for that. So now, what do you do about it? Well, if you are low in methyl, you've got to provide methyl groups. Okay? How do you do that? Well, that's very interesting because for the longest time, and still currently, many people out there believe that you give folic acid because folic acid is a wonderful methyl donor. Guess what? Not exactly.
No.
At the DNA level, folic acid steals methyl away. Now I want to share with you something. What is it that almost every pregnant woman is asked to take? Folic acid, right? Now, don't get me wrong. I am a doctor. I too will tell every woman thinking about pregnancy to take a multivitamin that contains folic acid because we want to prevent neural tube defects. We don't worry about brain pathology if there is no brain or spinal cord. That must be done. But the question might be, how long should we really be doing this? We know in the development of organ systems, it's really 3 months, embryologically speaking. Okay. So maybe we need to start rethinking how long we're giving folic acid to individuals, because the one thing we don't know, we can always test mom, but what about the developing fetus? What if they're genetically or epigenetically rather an undermethylator, and we're giving them folic acid, which steals methyl at the DNA level, not just through pregnancy, but now the breastfeeding mother is supposed to take these things, and it goes on and on and on. Okay. We have to be careful. What we're seeing is that we're actually wielding very potent elements that are now affecting genes and genetic expression. Okay. The opposite is that when we have an undermethylator, we actually give them elements like methionine. Okay. It's a great methyl donor, and it works that way at the DNA level, not just the cellular or organic level. Okay. Why do I go through all this? Because, folks, I needed to bring you up to speed with basic biochemical insults in order to talk about the biochemistry of the adolescent brain. Okay. Now that you've mastered all this and it's in all your memory banks and data banks, let's start talking about the kids properly. Okay. First of all, what is adolescence? Pardon?
It's until a person's 26, right?
So a person is 26, okay. What's happening during that time period?
A maturation.
Maturation. So with maturation, what is there? Growth. And what's happening in that growth cycle? The mind, the body, and everything that has to do with either one of those things is in a process of rapid growth. Okay. What did we say was necessary for growth to exist? Well, zinc. Zinc is key in the growth and development process. Okay? So now, God bless you. So now let's talk about the adolescent who has not just physical growth to do, but now outside of the structure of the brain, let's talk about emotional development. It's a very tumultuous time period in life. We have stressors. We have emotional stressors. We have social stressors. We have physical stressors. We have dietary stressors. We have sometimes drug stressors. What I didn't tell you before was how pyrrole disorder can be made worse by stress. Any form of stress will worsen pyrrole disorder, whether it's emotional, social, physical, drugs. You
Or
break your leg,
combination.
or a combination thereof.
Mhm.
You break your leg, you get cancer, illness. All those things increase pyrrole disorder. Now remember what we said pyrroles do in the system. They take away zinc and vitamin B6. So now, these poor kids who are tremendously stressed are losing more zinc and B6 from their systems than they care to admit or care to know. So what's that doing now to their neurotransmitters? Their neurotransmitters are now wildly out of balance. We associate the neurotransmitters with emotion and cognition. Okay? And we're wondering why our teens are okay one moment, sad the next moment, rageful the next moment, when the neurotransmitters are absolutely out of sync. Okay? And it gets worse, because the more these things happen, the more the vicious cycle of pyroluria increases. The more that increases, the more oxidative stress occurs. And therefore, brain inflammation. You ever seen an inflamed brain? Not quite literally, but you've seen the manifestations thereof. I'm sleepless. I'm irritable. There's just this feeling of not feeling quite right. I feel cloudy in my brain. It's like moving through a fog. Ever experienced teens like that before? A lot of times they won't tell you, but they're just kind of sitting down quietly for a minute, locked away in their room. And why is that? They need to try to calm down from all the outside activity that is hyperstimulatory to their senses.
Where do
They're in
sleepwalkers fit into that?
Oh, that's a loaded question.
Mhm.
Different lecture.
Okay, sorry.
Not so much from pyrrole disorder, actually, but,
Okay.
but other elements can kind of move into that whole. I think that's a whole condition of sleep and REM and delta waves and things like that. It's a little bit different. But the idea here of oxidative stress and brain inflammation is extremely important when it comes to pyrrole disorder, because pyrroles are ultimately markers of oxidative stress. Now, anytime you've got a rapid growth phase in an individual, usually there's pyrrole disorder. Now I'm going to bring something else to mind. Anyone here ever been 2 years old? Absolutely. Rapid growth is seen in 2-year-olds, right? Or the kids in that age range. And what are they like? They're running all over the place. They're inconsolable. They're happy one moment, mommy, I love you. The next moment, yeah, I can't stand you, blah, 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 and running all over the place, right? And what happens? They have sensitivities. Oftentimes, they're running around half naked, right? They get home, and the first thing you know is they're taking off their shoes, their clothes, and so forth. Why? Oftentimes because they're sensitive to tags. Remember, with pyrrole disorder, one of the things you see are sensitivities to light, odor, sound, and texture. Okay? So now, I want you to recall periods of major stress. 2-year-olds, rapidly growing. Teens, they have something in common. Most of the time, they're little raging pyrroles, I call them. Okay? So keep that in mind when we're talking about these growth phases and our teens. So now, pyrrole disorder is one of the key elements to consider in any teenager. Now, we talked about diet a little bit. What's the diet of a teenager like? Poor. Okay? Very, very poor. They're not getting the baseline nutrients they need to break down to the appropriate amino acids, et cetera, et cetera, et cetera. Okay? Now, let's move on beyond this. Okay? Let's kind of focus on these things. Our teens who are at home, oftentimes they're engaging in strange behaviors. We just say, oh, they're just teenagers. They'll grow out of it. Well, that's true to a small extent. What about that population of individuals that we don't quite know about because we haven't done any testing on them, who look like all the other kids, but perhaps they're severely undermethylated or severely overmethylated? or perhaps they are pyrrolic, or perhaps they're carrying around a strong zinc deficiency, or even worse, a combination of all of the above. Okay? Those are individuals who we simply cannot allow to engage in those common behaviors and just excuse it without checking. One of the things we always talk about in society is we talk about the fact that parents need to be more involved. We say, you know what, keep an eye on your kids. Doesn't mean that you have to not be a friend, but remember you're a parent first. Okay? If you've got a history in your family, Cousin Ed, Uncle Luther, Aunt Gertrude, of anxiety, depression, bipolar disorder, schizophrenia, any of those things, or just depression or anxiety, or remember Aunt Martha that nobody really talked about? She just kind of sat in that corner and that was just about it. Okay? There are signals being given to you that somewhere perhaps in your lineage, there's either a genetic or an epigenetic difficulty that can lead to larger problems in your children, or maybe even hidden in you. Okay? So when Johnny is kind of sitting there quiet and you just have this little feeling that something's not quite right, don't just pass it off as, well, he'll just grow out of it. Talk to him. If things seem even more problematic, you might want to have them evaluated, have them tested. Okay? These are very, very important elements because one of the things we know, teenagers tend to be very bright. They're smart. I remember hearing somebody say this when I was a teen way back when. They said, you know what? You kids are probably smarter than we are back in my day, but you're not as well educated. Okay? Remember that one? Well, at least we got that speech. And I say the same thing. Kids have an enormous amount of information, an enormous amount of access, but they have far more pressures than we did growing up. Okay? All these issues with regard to the internet and exposures to a great deal of propaganda, a great deal of the bad stuff in life, so to speak, hypersexuality, drugs, teen pressure, all these things are escalating now. The pressures on our kids, the stressors, are far greater than they used to be. So now what is that doing? If you had a predisposition running in your family for any of these disorders that can contribute to things like major depressive disorder, anxiety, or schizophrenia, or bipolar disorder for that matter, it behooves you to be very careful and watch your kids. Okay? We got into a phase somewhere in the 1960s where we just kind of said, I don't care what my parents, what my family thinks. I'm just going to go ahead and marry Gertrude. She's the girl of my life. They don't even need to meet her. I'm just going to run off and elope. And then you kind of find out that maybe your third child kind of acts like Uncle Edgar that you never met, okay, who has rage disorders. Okay. So the key here is take a look at who you're planning on marrying or who your children are planning on marrying and get to know those families well. Because it all plays into your future life. Do not delude yourself in thinking that none of that is ever going to show up in any of your generations. Okay? Far from the truth. Now, I'm going to pause there and I'm going to talk about, just answer some questions. I think we've got a lot of questions, so feel free at this point.
So, common themes as children grow up. I'm thinking about one of my children who many times we used to joke when he was 2 and 3. I tell his older sister, okay, let's go bring Timmy back into our world. He's always in his own little world. Fast forward elementary school, many teachers kept saying, ADHD, ADD, and I kept saying, you know what, just feed his lunch to him over the course of the longer period of time, over the day, and he will be very cooperative. And he was also the kid that crashed if he didn't regularly eat often. And now, well, I told you now. And so there's things we've missed, clearly.
But you know what? Your gut instinct was there. But we didn't understand how those things start at an early age. and there's symptoms and signs that are present, and then different things start to show up in larger pieces, and then finally, at some point in time, we crack. We all have what I like to call chemical armor, and this is what years of art school has done for me. Human being there, a little heart going. Okay. This lovely amorphous form is what I like to call chemical armor. It is what we were designed to have at a genetic level that's supposed to protect us against various stressors. Every single one of us has chemical armor, and we are designed to take, these are dents, by the way, X number of hits throughout life. Okay. The difficulty is that we don't know how many hits there's supposed to be for any given person. This could be absolutely no hits in the child who's born with autism. This can be a few million hits for the person who becomes depressed only after they become CEO of some corporation. Or it can be at age 24, 25. We've been straight A students. We've had great success on the athletic field. We are really what looks like the American kid until we get to college or until we get to graduate school, somewhere between age 20 and 27. And the stressors are too much and we crack. We may become bipolar. We may become psychotic. We may become schizophrenic. All of these are possible because our chemical armor simply gives way. But here's the interesting thing. Oftentimes, they're actually early warning signs. One of the keys that we want to bring across here is that if you just have a suspicion for some reason that something's not right, follow up on that suspicion. It doesn't matter what age category you're talking about. You might be preventing a very difficult situation later. Okay. Dr. Walsh, one of the early pioneers in this field, did a lot of work with regard to prison sociopaths. He's analyzed different chemistries regarding some of the I can't mention them for public reasons, but some of the most well-known criminals. He's been asked to comment from Scotland Yard and the CIA and the FBI on many a case. And what we see is that these individuals have very specific chemical types. Okay. And addressed early, guess what? A lot of those things might not have happened. I say might, because we're not going to say 100% everything is mutable. But there can be interventions and changes made early on. And even while the individuals are currently in progress. But the key thing here is that things evolve, and each one of us reacts differently to stressors. Any of these people who are not in perhaps as stressful environments might not have become these individuals here. What is stress to a person who lives out in the country, has one or two dogs, is by themselves? They can go throughout life never realizing that they had a stress limit or capacity. Take that same person and put them in an urban environment, and they could just have horrendous reactions and flee. So that's kind of just the issue here, is that we didn't know a lot back then. Okay? And what we know now is that if something just seems off, have it evaluated, have it checked out early. There are often early interventions that can really help and change the course of things.
Could you talk about omega-3 and niacin, please?
From what perspective? Those are big topics.
Yeah, as complements to zinc or other vitamins.
Sure. The idea of omega-3 fish oil is very important with regard to brain development, nourishment, myelination, all those fun things that keep electrical activity and cognitive development moving and flowing. Here's the thing, however. If you are pyrroluric, omega-3s are not what you need. You need a greater ratio of omega-6s found in elements like evening primrose oil or borage oil than you do omega-3s. It actually moves you into the opposite condition. In pyrroluric conditions, if they're extreme enough, omega-3s will push you into a pro-inflammatory state, as opposed to what they typically do as an anti-inflammatory element. Okay. Now, niacinamide has been highly touted in a lot of the early books by individuals like Abraham Hoffer in treating schizophrenia naturally and so forth and things like that. Very important element, but it is not the key that was previously thought. A lot of things have come a long way since the early individuals who were doing a lot of research in these areas. Not to say that niacinamide is not important. It's not the key. The key is looking at methylation, because people in that category can be one of three generalized categories. Sorry to use that word again.
No.
You can have over-methylated schizophrenics.
Mm-hmm.
You can have under-methylated schizophrenics.
Really?
And, I'm not done yet,
Okay.
you can have pyrroluric schizophrenics. Each one of these requires different elements to treat, and each one of these responds at a different rate. Which really brings me to a point that I wanted to make earlier, which was that just looking at the different micronutrients that we talked about, you notice the commonality? A lot of them produce the same symptoms, right? How many ways can you be anxious? From what we talked about, you can have zinc issues, copper issues, vitamin B6 issues, 2 different types of methylation issues. That's 2. And we also didn't talk about, well, let's just use those for example. 1, 2, 3, 4, 5. Actually, there are about 6 different biochemical ways that you can develop anxiety. Okay? So now, if you just go by symptoms for somebody who says, I'm anxious, give me medication, you're not really treating the problem. And if you try to presume that one drug is going to take care of this symptom, once again, what you're really doing is trying to put a Band-Aid on a crack in the wall that is really just a floodgate waiting to happen. Okay? This is why it's so key to actually investigate by doing testing, because anxiety has multiple causes. Depression also has multiple causes. Many different elements that we normally would just give a label to in the psychiatric world have many different potential causes, and sometimes there are multiple causes coming together. Okay. I just wanted to bring that up since we were talking about the 3 different categories that are seen in schizophrenia.
Isn't there another one with gluten? Like schizophrenic component too?
That's more adjunctive in terms of the contribution. It's not a major category. These are sort of the 3 major ones.
So why is it so common to just throw pills at the symptoms?
That's actually a very interesting question. I believe it actually goes back historically to a wonderful doctor by the name of Dr. Lister, who came up with the idea of bacteria. He was actually laughed at. Very interesting story. He told a group of surgeons, you know what? I believe that your patients are dying because they're bacteria in the body that, you guys aren't washing your hands, you're not sterilizing your instruments. And they laughed at him. They said, let me get this straight, Dr. Lister. You're trying to tell me that these little tiny microscopic things that we can't see that are causing disease and disturbing and killing our folks, right? He said, yes. They said, oh, you just go away and hide in the corner somewhere. Well, you know what? They started sterilizing the instruments and people got better. And they didn't die after surgery as much. But what that meant was that now the world of medicine started looking at outside invaders. And we started to develop antibiotics to treat the outside invaders. And slowly the world of medicine stopped looking at the internal world as causes for a variety of elements and began focusing on the outside world. So now we moved from biochemistry to pharmacology. And what we all seem to forget as physicians is that the roots of pharmacology, our drugs, is the biochemistry. Okay? Many a drug is designed around a biochemical construct. And that's how we manipulate receptor sites and so forth. Okay. But it was this moving toward the outside world. And then all of a sudden we started seeing that there are these things showing up, these cognitive disorders, anxiety, depression, schizophrenia, bipolar, et cetera, and we're kind of like, well, we forgot about the internal world. We think it's just this mysterious thing because none of the tests we have for them really show us anything. So the best we can do is try to manipulate neurotransmitters. And that's how this process kind of evolved. That's my version of it.
They call it balancing, don't they?
Absolutely. Well, they're balancing what they believe is neuropharmacology. Okay. They're not really balancing neurochemistry, because that's what we do. We look at balancing neurochemistry. Yes. Any other questions? Did I fully answer your question?
You did. You did. Mm-hmm. Mm-hmm.
I
Yes.
don't know how relevant it might be to this.
Every question is relevant.
Okay.
Yes.
How does insurance recognize these tests? Like, are they kind of validating it?
No, not yet. Because if your doctors don't yet really know about these tests, your medical schools don't know about these tests, all the insurance companies, because this is not stuff that.
This is brought down from research.
Correct. Absolutely.
Well, with that being said, though, too, is that some of the regular blood tests that are done to measure certain nutrients are covered, because that is something even any physician can order.
Sure.
So,
Like vitamin D, for example.
but some of the specializing testing, no, it's testing that we have had retrained a lab to do in order to, and perfected that system to get the biochemistry identified. And mostly that has to go in the area of recurrent disorder and methylation. Yeah, so some people that come to our clinic, depending upon their insurance, we will give you the ICD-9 codes, and then you would submit them to your insurance company. And from there, we've had a mixed group. We've had some people from the same insurance company get accepted and others not. So
Interesting.
we work with
Very
you
true.
on those codes to see how we submit them in order to get some payment from it. The one nice thing about coming here to Mensah Medical, to become a patient here is an initial appointment. One initial appointment takes about an hour to hour and a half. It's a very full evaluation by our physicians and the nurse case manager that will be assigned to the person's case, so to speak. And we want to know a lot about the extensive history as Dr. Mensah talked about today, and things even about pregnancies and childhood, teenagehood, adulthood, and it's just yourself, and as much information that you know from your own parents that told you.
Family planning.
Family, yes, family things. And so from there, we then the doctor will order the tests that they want you to take, and we use LabCorp for the majority of the testing, so that might be good for some of you who are LabCorp lab with your insurance company. And then the specialized testing is through direct health care, but we have one person from direct health care that kind of coordinates the whole thing. So you have this one visit, and then once the test results come back in, you don't come in. We actually, the doctors write the program, they evaluate it, they team together, and they look at everything they gather from your visit and any other information that you provide to us. And by the way, some people send us other diagnostic tests, CAT scans, things like that, all that, the reports we want to see. And then they write the program. And then the nurse case manager will call you and over the phone review and we'll send you that program so that together you're having it in front of you to kind of go through what the doctors are recommending as the compounded formula. That's an individualized targeted biochemistry program that's going to fix your imbalance. And we use a compounding pharmacy out in Maryland called Village Green Apothecary. And then from there, you get your nutrient program. It's compounded and designed just for you, so that, hopefully you're not taking 12 or 15 or 20 different single supplements, but instead they're jam-packed into, anywhere from 1 to 4, maybe 6 capsules, depending on your weight and everything else that's kind of factored into that. However, that being said, some of our patients still go ahead and do the individual supplements. We really wouldn't do one or the other, and some cannot be compounded. For example, fish oils can't be compounded into your capsules. So anyways, you get that, and then we don't see you really generally until we want progress reports every month to the nurse case manager. You get access to our physician and your nurse, and then we see you in 6 months, and usually things are going well. It's only annually. So it's we're not a practice that people see every week or every 2 weeks. We can certainly handhold you, talk to you, whatever, on the phone. If you are in the area you want to stop in, that's fine too. But this is how this practice works, then it works really beautifully that well. And that way, you're not spending a lot of money on office visits. So
It takes time
Mhm.
for chemistry to change.
right.
And you don't want to try this at home because, quite realistically, after we've seen the challenge, after we've seen the difficulties, after we've seen the real effect that people taking certain nutrients have, there's a tremendous amount of energy that's present in nutrients. As a matter of fact, since I'm on that topic, I didn't write this, okay, just so you know. But the Walsh Research Institute founder, Dr. William Walsh, wrote a book called Nutrient Power, and it really talks about the effectiveness of nutrients, the potency, but really based upon the foundation of biochemical aberrations. Okay. It's fixing with nutrients. That's the part that's actually broken, fixing it with what it is it needs, as opposed to using drugs. Okay. It's a very, very interesting exploration of elements that we didn't even get to talk about, involving epigenetics, involving the power at the DNA level, and how nutrients affect those things. Quick example, you hear about this wonderful product called Life Source. I hope there isn't one out there. I'm just making that name up, I hope, okay? And you take it, and there are all these products for cleansing, and there's colonic stuff, and there's energy stuff for metabolism. And you take it, and you feel great, and you tell your friend about it, and they say, I didn't get anything out of it. Or even worse, somebody says, I didn't feel good on that stuff. Okay. Well, you say, but it works great. They swear by it. Well, the difference is you have a different biochemistry than what these other folks have. So one size fits all is not a model you want to go with. Okay. That's why we look at individual and targeted therapy. We test you. We look at your symptoms specifically. We even told a family of sisters, don't compare your programs. Okay. So what do? They compare their programs. As a matter of fact, it was 2 months later, one of the sisters, and they lived in 3 different parts of the country. The Midwestern sister called and said, you know what, my sister on the East Coast, she's doing really well. I want some of that folic acid in my program. I looked at it and there's none in there. I said, ma'am, you have the opposite chemistry as your sister. It's going to make you feel worse. You know what I heard? I don't care. I want it anyway. I said, such competition amongst siblings. Okay. But the biochemical individuality is present. Yes, indeed. We are related in many cases, but it doesn't mean we're all exactly alike.
I'm just say one quick thing. My father was a patient. You were actually his doctor. My father came to fight for bipolar resistance for Alzheimer's. And my father was amazing, and he has since passed away. He's 92. But he lived a wonderful life. And his condition improved, and then it leveled off, and then he got pretty bad flu, and he kind of nosedived and kind of stayed there until he died. But he had the diagnosis for like 10 years, and he was under treatment for about 6. And anybody who has any questions, I know when I first came here to some of these seminars, I was like, this can't be possible. I mean, it sounds too easy, and it's possible. And I've been to many of your seminars of Dr. Walsh's and stuff, and I'm here again because I can't get enough of it. And I am going to be a patient because I want to be tested myself for Alzheimer's because maybe there's a hereditary factor. I hopefully have no symptoms yet or anything, but I just want to be, But it is, I see this whole group of what's happening as the future, like you say, with the surgery and the bacteria kind of a thing, and that totally changed. I see that happening,
Well,
psychiatry and all these mental issues.
I can tell you how frustrated I, as a parent, have been with our medical profession as it relates to trying to help what is now diagnosed a mentally ill child. And fundamentally, I have known that it's a chemistry, and I'm not that smart. I'm not a doctor, but at the same time, I knew that things weren't being treated correctly. And I'm not one to throw pills at symptoms. It's just, it's just not the way I think, and certainly not the way I wanted him to be treated. And so many different prescriptions, so many different reactions to the different prescriptions. From diabetic comas to I'm so frustrated.
You're in a great place.
Thank you for sharing that.
Yeah.
We're not against medication. We believe that it has its place. And sometimes individuals, for a variety of reasons, actually require some level of pharmaceutical help. But the key is that we're also looking at building a strong foundation. Quite often, and as a matter of fact, I want to say a huge proportion of these individuals do well just with nutrient therapy, because it's the chemistry that's broken. If you don't fix the chemistry, the pharmacology is only a band-aid. Okay? And that's the approach we take. Now, what we've seen, though, is that unfortunately, some of the latest research is showing that some of the individuals who've been on pharmacotherapy for several years, and depends on the medication specifically, have brain chemical changes that are somewhat resilient or resistant to nutrient therapy. What I mean by that is that they don't get full recovery to the point where they could be off their medications. They may get 50 to 75% better, and therefore need only a very minimum dose of certain medications. But the combinations exist, and we don't know who's who until we actually test them. But people are treatable, people are recoverable, people do well. We've had schizophrenics, by the way, who are holding down part-time jobs and going to school part-time.
Well, I will tell you that because I've been so honestly pissed off, I took him off everything. I did. And I basically have been hand feeding him. And this is for the last 2 months. He's not on any prescribed medication at all. And he's now back working full time, has a bit of a darker personality, but at the same time, I see remnants of him again.
No, we don't recommend you take people off
I
their
know,
medications.
I know, but he was almost catatonic.
What medications now?
They started him on, oh my gosh, I'm gonna, not because I'm not a doctor, but the ones that I just recently took him off of were Seroquel and Depakote. And he just seemed like he was dead to the world.
What I want to kind of reference here is something very important. What we do at Mensah Medical and clinics like us is that we deal in comprehensive medicine. We're not purely just looking only at biochemistry. We're looking at the whole picture, molecular biology, genetics. We're looking at pharmacotherapy. We're looking at nutrient therapy predominantly. But the idea here is that what was the piece that we've forgotten in regular medicine? Okay. That piece is going back to the foundational construct of biochemistry. So now we take that and we look at all these cognitive disorders through the lens of biochemistry to see what's missing, what's out of balance, and we try to put those things in balance. Okay? But the idea is having the complete picture, not just focusing on certain pieces.